Welcome to Dental Vibes. I'm Gabby.
And I'm Carla.
And if you're new here, we are dental assistants that love to talk about everything in dentistry. So in our channel, you can expect to see contents for our fellow dental assistants, but also for anybody that loves their teeth and wants to take care of their oral health.
And if you're returning back and you already know us, thank you so much for your support and for subscribing. And since you're already here, go ahead to like this video and all of our other videos if you haven't already done so. Now, today's subject, it's about the 5 biggest mistakes that all of us dental assistants make.
We all done it.
Yep.
Somewhere in our career, and a lot of us, including us, we still make mistakes every day.
Oh yes, it's an ongoing thing, so don't be too hard on yourself and let's get started.
As dental assistants, we have a lot on our plates, so you're going to make mistakes. It's overwhelming, it's intimidating, especially when you just start.
Oh yeah.
And you're in a brand new office and you have no idea what you signed up for.
I mean, I think we both went to like year-long programs, and all that time there, you still don't feel like it's enough practice, enough classroom time.
Too.
You're just nervous, and I just feel like you just have to, like you said, buckle up, get a job, and enjoy the ride.
I mentioned before, even dental assistants that have been in the field for a long time, we still make silly mistakes here and there, and that's just what it is.
Can I just say that we recently made a funny TikTok about the veteran DA versus the newbie, and we were getting the type of comments that people were like, oh, I'm new, I'm gonna start, like I'm scared, and they were like veteran DAs that were like, hey, no, I'm nice to the newbies. You know, it like created a little conflict when it was supposed to be a funny video. But, you know, the whole purpose was like, hey, if you've been in the field for many years, help the newbies out. And then the newbies like, we were kind of teasing you, but we were there. I was definitely there because I was super shy.
I mean, help the newbies out, but also I truly believe in tough love.
Yes.
Because if you just...
Especially when they're interning. If you get an intern in your office, like, be tough, but like tell them.
Tell them
this is
why
we do things.
Quiz them, because if you're just nice and like they're just following around, then really they're not learning. But if you're like, listen, I'm gonna get on you. Trust me, it's all from love. But you know, it's to make sure that you're gonna be ready whenever you're done with your internship. But we're kind of getting sidetracked here. We are gonna go ahead and start with mistake number one.
Which one is it?
Number 1 is when you, and I know we all been there, when you make a horrendous temporary crown and patient leaves and you're just like, what did I just do?
You just keep thinking.
It's too late. It's right in the patient's out the door. Then you're driving home and you're like, oh my God, that was so horrible. And it's just following you around. You know, you try to go to sleep and you're thinking about it and you just feel horrible because you know you did a horrible job.
And the worst part is, it's like, you know, hopefully you get to sit the new crown with that patient so that your coworker dental assistant doesn't have to see that horrible temp that you struggle with, right?
And just think, what is this?
And just have like the whole office find out that you made a bad temp.
You know, I have a funny story about when I was an intern. They threw me out there very early, and they were like, okay, so today we're gonna do crown preps on 8 and 9. We're busy in another room, so go ahead, see the patient and take the impression for the temporary. And I'm like, oh yeah, no problem. You know, I've watched this a few times. You know, at that time I had some temporaries under my belt, so I'm like, okay, I got this. So I go and I take the impression, just like a interior quad tray, right, with alginate. I don't know why, don't ask me, but you know, everything is fine. So we prep the teeth and you know, everything. So they're like, hey, we got an emergency, like we gotta go and see this patient in another room. You got the temporaries, right? And I'm like, yeah, no problem.
Which group was it?
8 and 9.
They let you, like, as a newbie, do an 8 and 9 temp?
Yes.
Wow.
So I was excited because, you know,
you're like, oh my God.
I'm like, you know, I got this. So I go, put my material in my impression, you know, put it in the patient's mouth. Right, check if it was set. I'm like, okay, it's set, take it out. And I realized that when I set the tray was not properly placed, and it came out like a blob. So I'm like, okay, shoot, this did not come out right. I have to redo it. When I removed the impression, the temporary from the impression, I realized the impression is ruined.
Yeah, of course, it was already drying up.
Well, it was dried and pulled the impression apart. So I'm like, what went wrong here? Like, why? And then I was like, oh my God, I used alginate.
Yes.
Like, why? Why would I do that? So it was like the worst day of my life. It was 8 and 9, okay? I mean, I thought, that's it, they're gonna send me home. They're never gonna see me again. And thank God the assistant came back and she's like, wow, I got this. So she just made 8 and 9 out of like composite. Pretty much had to build everything from scratch. But
shit.
It was fine. But
that's my expression.
It was fine, but you know, I will never do that again.
I mean, I gotta say, I struggled a little bit, but I would say that I was lucky that I eased my way. I never had an experience like that. And I feel very comfortable about making temporaries right now, but you like in love with making temps.
I love it
so much. If you're still struggling with temps, we actually created a video. I filmed a video of Gabby teaching us step by step of every tool she uses, how she does it, because we all know you're very passionate about it. So go ahead and check it out.
Now, number 2, is when you take that bed impression. And and you're like, you know, it's not that bad. Oh, this year it's alright, fine. You know, I'll just fill it in. It'll be fine.
And then it's not. And then you pour that and it's crap.
Or you send it to the lab and the lab calls you like, we need a new impression.
That's like really embarrassing. That's like everybody finds out. I was the worst at mixing alginate, taking alginate impressions, and pouring models when I was like, I could not do that if it required saving my life.
Right.
Like that's how bad it was. But now I got it. It's just one of the things that it takes practice, knowing the material, how it feels, and all that.
The thing is, especially for newbies, it is. Patients hate taking impressions.
Yes.
So you don't want to tell the patient, oh, I messed up on this impression. Now we have to take another one. Sorry, you don't want to do that. So then you tell yourself, that's okay. This impression is fine. You know, I can fix here. Like, it's no problem. And then it's going to bite you in the butt next time. Because then you're going to have to call the patient, come back to the office, take another impression. It's just a hot mess. So please just be on the safe side. If you are second guessing yourself that doesn't look perfect, then just take it.
Do it again.
Now, the third one. This is a funny one. So, suctioning problems. Who's been there?
Nothing so bad. I mean, for sure you suction tongues, the cheek,
the floor of the mouth when it gets stuck.
Yes. There's one story that I just can never forget. It's my dental assistant teacher. She told us once that when she was a newbie, she was having trouble suctioning with, you know, her left hand. Like, it's uncomfortable, especially if you're righty. And she suctioned the doctor's mask. And I'm just like, even at that time, I'm like, wow, that would be really embarrassing.
That would be so awkward. Like, what do you say? Like, oops, sorry. And you just continue on.
I don't know.
I mean, maybe I've had some weird story with suctioning, but I can't really remember right now.
No, because you've like blocked it out of your head.
You're like, I don't want that to never happen. But I know that there's a dental assistant that said that she suctioned the patient's hair. I don't know how that happened.
Gross. Well, I guess like if it's like
maybe she went to like turn and she just like suction the. But I mean, that's if it's a nice patient, I'm like, oh, that's okay. But if it's a Karen, that's not gonna go well.
Yeah, that's not gonna go well.
Also, another assistant said that they were doing a tissue graft and she suctioned the tissue.
Oh no!
I would have died.
I don't even know what I would do right now if that happened.
I would be like, thank you for your time. Have a nice life. I'm firing myself. Another one, and this one I know that even assistants that have been in the field for a long time still do this, okay? Including us, yes. Which is throwing things away, especially expensive things.
Yeah, I think I've thrown away everything that you can throw away in the dental office at one point. Implant parts, obviously the driver, that's a given.
Expensive ones, yeah.
Impressions, models, a whole damn case, just, you know, what else?
And that feeling when you realize it just hit you that you lost something, you're like, oh my god. You try to like backtrack yourself like at every step. So I definitely had to dig into the dumpster.
Oh, I've been in the dumpster.
Yes, for a crown case. I threw it away with the empty boxes.
Oh, okay.
And thankfully I realized right away, and I was like, wait a minute, did I just throw that case? And I had to dive into the dumpster. Thankfully, I saved it, I got it. But just telling your doctor, hey, I threw this thing away, it's just like so nerve-wracking.
Yeah, it's embarrassing.
It is. I feel like air water syringe is something
all the time.
Especially hygienists.
Yes.
Always lose the air water syringe.
Yes.
Oh, I lost a driver, implant driver, like a month ago.
Oh.
And in my defense though, I did not throw it away.
Okay.
I don't know how. I took the tray to the sterilization area and I realized it was not on the tray. So it probably fell somewhere.
Yeah.
And I have no idea where it is.
I
think we'll find it someday.
I think that counts as throwing away though.
Okay then, I did. But you know, I realized right away, and I told the doctor right away. I was like, oh my god, I think I just lost the driver. And his first thing was like, what?
I like that you owned up to it because I've owned up to my mistakes always. Like I lose something, I don't know how to do. Even nowadays, like, you know, it just happens. But I've worked with people that are like, well, I don't know what happened, and it's just like
I didn't use that.
Yeah. It's so much easier that you say, hey, when it happens, hey, this happened, so somebody can either help you or start getting a backup plan together.
Help and then you dig in the dumpster.
And then just like move on, you know, because it's gonna happen and
and learn from your mistakes.
Oh, that's 100%
because now I'm literally paranoid with the driver.
Yeah.
Every time I'm gonna use a driver, I make sure that it's on the tray, and you know sometimes I even get a little cup and I put every little stuff in a little cup. Because you know if you are constantly losing things, then you're just like, oh, I'm just an airhead. Like it's just
we're not saying it's okay to lose things. You definitely gotta learn and just be I don't want to say more responsible.
Be aware.
But definitely more aware of everything that you have to put back together.
Yes. We know there is a million mistakes that assistants have made and named, but we only have time for 5.
Yeah.
So it's overstay in a bad office. We hear unfortunately so many dental assistants that claim to be in a really toxic office, that they, you know, the doctors are horrible, they treat them like crap, you know, their co-workers, or, you know, there's so many reasons why an office could be toxic, but it's not okay to stay. And I know we all been there, especially like newbies. You don't know because
you don't know better. You don't know how it's supposed to be. I just gotta tell you that if you stay in a toxic environment, you will develop Stockholm Syndrome. That means that you start making excuses for like, why is this way? Like, oh, it's just that they have life problems and I'm just so understanding. Like, no, don't bring that. Don't get used to that, because you will. Like it only takes like a few days to just get stuck in a bad habit, and that bad habit of staying in a toxic environment, especially the workplace, in any profession, that's a no-no. You cannot do that.
Or they just accept it. They're like, you know, every doctor is mean. If I go to another office, it's gonna be the same thing. Every office is gonna be the same problems. Which, no, that's not true. I'm, people call me tough.
You are.
I just like to make sure that we take responsibility for what we do and what happens to us, because
you've hit the right point.
Because I really believe that you messed up with me once, shame on you. Twice, shame on me. Because especially with newbies, you start in the office, things start going south, you don't know any better, right? But then you probably will start talking to other dental assistants that have been in the field. Been in the field for a little longer than you, and realize that, hey, this is not normal. This office is clearly not a good office. It's a toxic environment for me. I'm just not happy here. And then you choose to stay for whatever reason. So
if somebody tells you to run, you just don't ask why, just do it.
Because at that point, even though, yes, they are doing all these things to you, but it's kind of your fault as well, because you should take the responsibility to stand up for yourself and look for a better opportunity.
Absolutely. I think that we should be number one to ourselves, because nobody else is going to stand up for you if you don't do it. And I like what you say, that it's like, hey, you don't like to waste money, you don't like to waste time. I think that 3 months, it's enough time to decide if you like an office or not. Heck, half a day. Like I was once in a working interview, and it was a full day. By lunchtime, I already knew I don't want to work here. I also recently came across somebody that's been 3 months actually in an office, and they're like, there's nothing really bad, but I just don't feel like I belong there. And I connected with that because I've been in that situation. I was in a pedo office.
Sorry, kids.
For 6 months. For me. But like the office was great, the doctor was good, and it just didn't feel like home. Like everything, that the camaraderie that I wanted with my coworkers, like it just, something didn't feel right to me. It wasn't anything obvious, but again, I just, after 6 months I moved on, because you just know you gotta listen to your gut feeling for sure.
And I mean, we're not saying, hey, every little thing that's going wrong, quit. Quit. That's not what we're saying. You can go ahead and watch our video to learn the red flags and discover if you are in a bad office or not. And of course, we have to throw another video at you, which is how to recognize if you have a bad boss. We'll link it below. But truly is, number one, you have to realize, okay, this is not okay. 2, if you really want to stay there, you want to make sure that you talk to your boss about it. And maybe just a talk will fix it. But if it doesn't fix it, then you definitely gotta leave. How about that dental assistant that's been in an office for like 30 years? She was getting ready to retire, and she didn't have a retirement plan.
It's a sad story.
They didn't even give her a card that says goodbye, thank you for your time. And it's like, it's sad, but at the same time, she had 30 years. Okay, she had 30 years. She knew that office was not treating her right. She knew exactly what kind of office it was. She knew she didn't have a retirement plan. So it's like, that sucks that they did that to her, but at the same time, it's kind of her fault as well. She has to take responsibility that she did not look for a better opportunity for herself, and she stayed in a shitty office, and that's what she gets. Unfortunately, we have to take responsibility, and we need to look for better opportunities for ourselves.
True. And with that in mind, if you've been in a toxic work environment, please let us know. Or if you've made another mistake or a big mistake as a dental assistant, Please share with us in the comment below because I think, Gabby, we're gonna have to make a part 2 to this video.
There's way too many mistakes to put in one video.
I think so.
But thank you for watching, guys, and of course, subscribe to our channel if you haven't so, and yes, like this video, hit the notification button so you don't miss any of our videos, and we'll see you guys next time.
Keep smiling.